Hello, and welcome, and thank you for joining us for today's session on leveraging resources to support employee mental health. This is part of the Lutheran Services in America Strength and Service webinar, where we focus on critical issues in today's environment to strengthen organizations going forward into the future. Today, we're very excited to introduce our guest host from Portico, Reverend Jeff Tiemann, President and CEO, who is also our partner in supporting behavioral and mental health. Learn to Live. Portico is a very strong partner of Lutheran Services in America and is a ministry of the ELCA. It's one of our premier benefits firms in the United States that provides comprehensive service-oriented, affordable benefit services. Today, we're going to hear from Learn to Live about how their self-guided, app-based cognitive behavioral therapy strategies can help your organization realize a healthier, more engaged workforce. We'll have the benefit of going through one of their webinars that's designed to provide you with practical tips to deal with burnout. We'll also have time for Q&A at the end, but please, as we go through this session, feel free to type your questions into the chat and we can take them as we go. So thank you very much. And with that, I will turn it over to Jeff Tiemann. Jeff.
Thank you, Charlotte. We are excited about the opportunity to join today, and I'm really looking forward to the conversation and sharing the information that we have for you. According to a 2022 study conducted by Mental Health America, the scope of unmet mental health needs is absolutely staggering. About 50 million American adults, that's close to 20%, experienced a mental illness in 2019. About 25% of adults with a mental illness report an unmet need for treatment. More than 50% of adults with a mental illness do not receive treatment. That's over 27 million people. Mental health support during these challenging times, especially for frontline employees, has never been more critical. In our 2021 research project, leaders in your organizations told us that caring for their employees was a critical priority. You said that you and your teams have been faced with increased levels of stress and a greater need for mental health support since the onset of COVID-19, which has contributed to, among other things, higher absenteeism, higher turnover, and difficulty in recruiting. Portico hears every day from those we serve across the ELCA about the burgeoning mental health issues facing those who serve others. Just the other day, I heard one of our plan members express some doubt about her future. Everyone's saying we're in new territory and we're not going back, that this is our new normal. Dealing with uncertainty, flexing constantly, and feeling anxious. She wondered if she had the capacity or desire to continue on her current path. When we were last together, you heard from two fellow CEOs, Terry Rodriguez and Ted Goins, about some of the things they're doing to support the mental health of their teams. I'm sure there are many more examples you could share, and I know that some of your organizations also provide valuable mental health support for those you serve. Stress can lead to burnout. So let's do a quick poll. How many of you are feeling the impact of burnout, either for yourself or across your organization? Go ahead and answer the poll. Quick yes or no answer. And when we have the results, go ahead and share the results and let's see what we think about this position. All right, 92% yes and 8% no. That's a lot. So today, we wanted to take the opportunity during May is Mental Health Awareness Month to give you a view into how Portico supports the emotional and mental health of those we serve and provide you with access to some of the resources available from our partner, Learn to Live. Portico believes in the importance of supporting whole person well-being, so our consolidated benefits package offers you and your employees comprehensive support for the financial, physical, and emotional well-being of those we serve. We regularly research industry best practices and claims data to identify needs that require new or different types of support. And then we find great vendor partners who can meet those needs. Often these vendors are ones that are not able to be accessed by one individual organization, but together we have access to them. And we do the heavy lifting to bring together the right partners who offer the right combination of behavioral support, as well as science and technology, so those we serve can get the help they need when and where they need it. When you work with Portico, your team works with us as its single point of contact to administer your entire benefits program. Portico does all the work to transmit employee data to 15 plus vendors and works closely with each vendor to ensure that the member has the right experience. When it comes to mental health support, Portico was ahead of the curve. Over the last 4 years, we've analyzed claims data and based on the needs we saw, created a spectrum of benefits and resources designed to help those we serve take a step towards better emotional health. For those who need help right now, our employee assistance program includes 6 in-person visits per issue per year at no cost for the member. Its purpose is to help people overcome difficulties so they can bring their best self to work. For those who don't know where to start, our care coordinators by Quantum Health are a helpful starting place. They're selected and trained to engage with our members, encourage conversation, and in a user-friendly way, describe their benefit options and provide a list of in-network mental health providers in their vicinity. For those who want to learn and explore, the Being Academy is our faith-based wellness learning platform featuring entertainment caliber video learning courses. It's designed to help people to explore and learn according to their own wellness needs and interests, with much of the content focused on aspects of mental health. And for those who aren't ready or wanting to work directly with a care provider, we offer an online personalized mental health program, Learn to Live, to meet that need. And now I'd like to introduce our partners from Learn to Live, Kari Erickson and Jess Smith, who will describe their approach to addressing mental health challenges and then take you through one of their most widely used webinars on burnout in the hopes that it might help you and your teams. As a leader in your organization, it's important that you help yourself as well as helping your team. And we'll give you access to these resources to use with your teams. Kari holds a master's degree in counseling and is a client success manager working closely with Portico at Learn to Live. Jess holds a master's degree in counseling psychology and is the clinical content specialist at Learn to Live, focusing on developing relatable and evidence-based content for webinars, articles, and digital programs. Welcome, Kari and Jess, and thank you for being here.
All right, thank you so much, Jeff and Charlotte. And again, thanks so much for having us join you today. We're really glad to be able to share a bit about Learn to Live and then talk about the topic of burnout. As we know, so many are struggling with that feeling right now. So to begin, we wanted to share some statistics around essential workers and their mental health. We looked at one study that was completed by Mental Health America. This group surveyed and listened to the experiences of healthcare workers during the first few months of COVID-19. This survey included a wide range of workers, including mental health professionals, social workers, community-based healthcare workers, as well as administrative support staff. You can see that the top theme that came out was that essential workers reported feeling stressed out and stretched too thin, with 86% reporting experiencing feelings of anxiety and 76% reporting exhaustion and burnout. Additionally, 82% saying they felt emotionally exhausted when asked about how they were feeling in the first 3 months of the pandemic. Another study in March of 2021, titled Stress in America, surveyed essential workers, and they found 54% reported they had relied on unhealthy habits to get through the pandemic. So as we talk today and I'm sharing these numbers, I'm sure many of you are nodding your heads and agreeing with these statistics. You are working alongside and leading employees who are telling you these things each day. And if they aren't saying it out loud, we know that many are struggling internally. And this is why Learn to Live exists. We live in a world in which at least half, if not 3 out of 4, will suffer from a mental health challenge and could benefit from treatment. However, many will not seek treatment. You can see there's a gap. And why is that? Well, significant barriers can include high costs. Costs associated with seeing a quality provider, taking time off of work, office copays. There's certainly high demand for appointment times. Many providers have moved from rural to more urban areas to practice. And so many who try to schedule an appointment can end up waiting months. And then the barrier of stigma. Looking at our internal voice, many feeling there is something to conceal, others feeling that a mental health challenge can reflect negatively on one's character. Dr. Russ Morfitt, a practicing clinical psychologist, noticed that stigma had convinced some of his patients that they needed to miss an appointment because they feared someone would, see their car in the parking lot of his clinic. All of these circumstances and barriers led him to co-found and create Learn to Live. He recognized an opportunity to bring high-quality digital solutions to market in 2016. So Learn to Live is built on the principles of cognitive behavioral therapy. CBT leverages our thoughts and our behaviors to improve our emotions and overall experiences. We offer a comprehensive clinical assessment, which is about driving the user to understand where they may be experiencing mental health challenges, as well as specifically what they're experiencing. Our 10-minute assessment is designed using 6 validated gold standard psychometric measures, such as the PHQ-9 for depression and the GAD-7 for anxiety. These assessment questions are also used when seeing any healthcare provider for mental health concerns. So we have our 5 digital self-directed programs, which are depression, stress, anxiety, and worry, social anxiety, insomnia, and substance use. We are adding 2 new programs to our offerings later this year, those being Panic and then Resilience Builder. Each program is available in English and Spanish, depending on the user preference, and is comprised of 8 individual lessons. So in general, we equate each lesson to 45 minutes of face-to-face therapy time. So as we look to be that evidence-based, clinically based application, we really do look at how the product performs and aligns to in-person therapy. And we also offer live member coaching. This is a 24/7 text, email, and phone service, and it's available for those that really want that personal interaction. Now I'll go ahead and turn it over to Jess.
Yes, excellent. Kari, thank you so much. And to the others who have brought us to where we are so far, it's so good to be with you today. And, based on that poll that Jeff conducted just a little bit ago, it's pretty clear that burnout is an important topic for us to be discussing today. And in case you missed it, 92% of those who were responding said that yes, either I myself or others in my organization are being impacted by burnout these days. And so if that's you, we want you to know today that there's hope. And specifically as leaders listening, you have the opportunity to model what it looks like to take care of yourself and take action to make the necessary life changes so that you can thrive. Our hope is that you'll have a few takeaways that you can use or even share out with others later today, tomorrow, going forward. So let's start out with these stories of a couple of people who are in a tough spot themselves. First, meet Margaret. She has 2 young school-aged children. Her spouse has been especially busy at work, so she's been carrying the load of solidifying activities and childcare For the upcoming summer months, she's feeling frazzled as the pressure only builds with lots of other anticipated change. Margaret has been asked to work more hours lately, and she knows it will continue into the summer. She's been feeling a bit lost as she works out the kids' summer plans, wanting to make sure that they're well cared for. She feels like time is passing and she's struggling to keep up, feeling as if she has little in the way of direction. Now, Micah is in a slightly different place, typically an outdoorsy and adventurous person. He's been working more than usual and hasn't gotten to enjoy the outdoors as much as in these last few months because of staffing changes at work. As the seasons transition, he's feeling rather drained. He's uninterested in work, and he's even lacking the energy to really enjoy his time outside of work. I've got to do something to turn things around, he thinks to himself, and fast. Otherwise, I'm just going to keep drifting and feeling empty. Finally, there's Al. He's worked in management and supervisory roles for many, many years. He's changed positions and employers several times throughout the years. And while things have been pretty stable in his current job for quite a while, he's actually feeling like he's ready for some sort of change. He's been enjoying work less and less and finds himself wondering, why did I waste so much time doing pointless work when I was younger? And what's the point of all this anyways? With retirement a few years away, he's in need of some sort of spark to help keep him going, to help him feel energized again, both in his personal life and at work. And so if you pause to consider your own life and how you've been feeling these days, what do you see? Take a look at the following questions and jot down a response for each of them, indicating which ones you agree with. Be sure to answer these questions as you actually are, rather than how you think you should be, right? And don't worry, some of the questions, they seem to score kind of in the wrong direction. That's okay. When you're finished, we'll help take a look at some of those answers and figure out what it all means. So the first question, again, make a note if you agree with it. I feel run down and drained of physical or emotional energy. If you agree with that, make a tally mark or just keep track on your fingers. The next one, I'm harder and less sympathetic with people, sometimes anyway, than perhaps they deserve. If you agree, again, tally mark, keep track on your fingers. Item C, I'm easily irritated by small problems, but with my coworkers and team. Next one, I feel misunderstood or underappreciated by my coworkers. And if you agree, keep track here. Next one, I feel misunderstood. Nope, sorry, I just read that one, didn't I? Item E, I think we're on. I feel I'm not getting what I want out of my job. Okay. Item F, I'm frustrated with parts of my job. And lastly, I feel that there's more work to do than I practically have the ability or time to do. So add up all those tally marks, and we'd love to hear from you. If you're up for sharing with us, what did you score out of 7? And it's okay. If you're not up for sharing with us, by all means, you don't have to. But if there's anyone out there that's up for sharing, my guess is that you're not alone in whatever you end up with, somewhere from 1 to 7. Good, a little bit of a range coming in pretty strong, kind of the middle to high end of this. Well, as we look at the range of numbers here that you could end up with, your score was, we'd say maybe 5 or higher, meaning that you had 5 or more out of 7 that you could agree with. You maybe had a bit of a higher risk of burnout, higher risk. And that this presentation may be especially valuable to you then, the strategies that we'll talk about here soon. If your score is 2 or less, then hey, you may be doing particularly well in terms of getting through the challenges of this season that you're in. But yet you may still feel like you're struggling in some ways. And again, we have ideas for everybody today. Before we go any further though, let's talk about burnouts and just make sure we're on the same page. So the term burnout has been described as work-related chronic stress, characterized by, as you can see, the emotional exhaustion, maybe some distance or a less sensitive attitude toward others, and what they're going through, feelings of inadequacy or incompetence. And so it's a problem that's reflected by our fatigue and in our interactions with others, as they might become kind of cold and we question our own abilities. Clearly, it's going to affect various areas of life when it's closely related to stress, right? Research has also shown, though, that there's a particularly close tie with depression. Talk about that just a little bit more here shortly. The good news is that we can build protective factors, make us less likely to suffer from burnout. These include seeking and fostering supportive relationships, as well as building some of our coping skills, things like assertiveness, enhancing our boundaries, those types of things. And finally, we can prevent burnouts as we build more and more in the way of resilience. And that might include modifying our lifestyle sometimes to become more active and engaged. So we'll talk about a little bit in those categories soon. I mentioned depression a moment ago. And so let's look at some of the data here first. Findings suggest that while overload at work can play a role in the development of burnout, it's the lack of a sense of personal development, the sense that my career is going somewhere, that often weighs in more heavily perhaps than other factors. And then 9 out of 10 people who reported being burnt out, they have those elevated markers for depression. That might be surprising to you. Maybe it's not. Maybe you've seen it or felt it. We know that when people are approaching that point of burnout, they're still often able to get to work. So it's actually their level of productivity that's the best indicator sometimes of whether or not that they're experiencing burnout. And sadly, research further suggests that working mothers are especially at risk of being stretched too thin and experiencing burnout, in part maybe because of the great demands that they experience at home. Excuse me. So we see here that the central role that stress, anxiety, and low mood are playing. And so if we're stepping toward recovering our own well-being, then it makes sense to consider some of our most potent CBT strategies, as Jeff was saying earlier, as Kari was alluding to. And so to start with, excuse me, one of the biggest strategies addresses this problem that happens when we get caught up in our thoughts, our worries, the stresses that play over in our minds. And if we can learn to let those things come and go, instead of getting so occupied on them, and then we can focus on our values, we can prevent a great deal of that stress and discouragement that lead to burnout. And so again, briefly defining our terms here, let's talk about what we mean by values. Life really is this journey. And so our values are a big part of finding and moving in a meaningful direction. So values, those are the things that are really important to us, right? Things like the kind of person I want to be, the kinds of personal strengths or qualities I want to develop. For some of us, our values involve being part of a community, or maybe I want to grow in some way, or I want to be more engaged as a parent or a partner or a friend. Maybe I want to develop a personal quality like generosity, and I want to live that out. Alongside those values then are goals that help us move toward, living out our values. So our goals, long-term or short-term, will ideally support my values. Maybe a goal could be to refinish the deck. Well, why? It's in support of my value of having a home that's inviting and ready to host people, right? Making a budget could support a value relating to my finances or discipline. You see how these two things really do go hand in hand. And when we identify our values and then create goals that support them, we tend to experience life as a journey, right? That leads to more fulfilling options and a greater sense of agency, that idea, that feeling that I can do this, I can do something about this, perhaps. So the question becomes then, what are my values? Maybe you already have a good sense of that. If you don't, though, you see here 4 questions that we have. You can ask yourself, begin fleshing that out. So this would be another good time to maybe grab a pen and paper, jot down some of these thoughts here as we go through these statements. We'll actually just talk about 2 of them. The first one, just again, consider it for yourself. When I leave the room, I would like others to say that how would you finish that statement? Maybe it's some qualities that you have or would like to be known for. Another way to begin thinking about your values, as I think about the days, months, or years to come, I want to be sure that I what? Again, what might you say? You can jot that down on a piece of paper in front of you. Now, there are two more statements that you can consider to build out your own values again. If you want to jot those down or take a quick screen grab, you sure can. But because our time is limited, we want to focus on the second one. And I'm going to ask for your participation again. If you're up for sharing with us, as you think about the months to come, how would you finish that statement? I want to be sure that I what? What are some of the first things that come to mind? We'd love to see some of those ideas come through the chat feature. You can always choose to just share it to host and panelists if you don't want to share with everybody. Give you a couple moments in case we have any brave participants. Spending time outside. Oh, it's such a good one, especially with the warm spring and summer coming up. Spend time with those I care about most. Yes. Finances, some travel stuff, getting healthier. What better time than now, right? A lot of people are feeling the same. Spend time with your kids. So good. Please feel free to keep sharing your thoughts here. Your thoughts might inspire someone else. But either way, be sure to come back to these statements as an exercise. And again, identifying your values or solidifying them. Maybe you've got some ideas in mind. Well, get them on paper. That might be a really good, helpful next step for you. Another important step, in addition to knowing our values, would be to consider other ways that we can exercise agency in our own lives. Again, that is taking action where we can in order to make a difference. And part of that is building a strong foundation of self-care so that we can move forward in a fresh way. Take a look at this animation from one of our programs that relates to how we can care for ourselves.
To live a full and meaningful life, your well-being depends on a balance of health, stability, purpose, and connection. These 4 areas include taking care of your emotions, a stable home environment, a sense of meaning or purpose in life, and friends or family to share it with. Let's take a closer look. The first of these areas is health. Being healthy involves making helpful choices to support good emotional and physical health so that we can pursue the things that we care about. The second is stability, which includes living in a safe, peaceful environment and having the financial resources to pay bills and meet our needs. The third area is purpose and involves the sense of joy that comes with pursuing meaningful activities that we care deeply about. The final area is connection. It is important to feel connected to others in relationships that provide support, friendship, and love, and to feel part of a community. These 4 elements are like the tires of a car. When all 4 are inflated and working properly, the road of life feels smoother, and we can more easily arrive at our goals. But if we ignore these areas, we'll have problems. Just like our car tires, these areas of life need our attention.
So you can see how these really are relating to a lot of those values that we were seeing from others just a minute ago. And moving forward then, despite life's challenges, might require us to address some of these important areas in life. And so let's actually consider these 4 tires one by one. And the question then would be, which of your tires really needs some inflating? And it's okay. Hopefully one area stands out more than another, or maybe a couple areas. So give yourself a quick rating from 1 to 10, 10 being fully inflated and 1 being completely flat. Again, jotting these down will be helpful for the next step here after this slide. So when it comes to health, are you getting enough sleep? Are you taking care of your emotional health? Is your body as fit as it could be? Are you taking care of your dental, medical needs? Considering some of those types of things, those are just ideas. Give yourself a rating from 1 to 10. And then there's stability. What do we mean by that? Well, do you have a budget in order? Are you taking care of your emotional health? Is your, environment safe and predictable, free of chaos? Are things kind of chaotic back home? How stable do things feel in your day-to-day life? Again, 1 to 10. Consider your purpose tire. That's whether or not you're pursuing things that you deeply care about in terms of what you really value, your spiritual life, or causes that you care about. Give yourself a rating. And then lastly, connection relates to relationships that are important in our lives. Whether you're an introvert or an extrovert, it doesn't matter. We all need connection. Consider whether you're fully nurturing those relationships. You should give yourself that number from 1 to 10. Remember, you can always come back to these areas and consider them further, but hopefully you've got a number now from kind of 1 to 10 as a starting point for each area. And we always encourage people for taking action to focus on inflating those tires that are the flattest to build up their foundation. So for those next steps, then you might consider what immediate action you could take. For example, if health was your flattest tire and you're finding your emotional health, right, is impacted too much by maybe wasted time on social media. No, not me. Okay, well, hypothetically, and taking care of your health right now might be to disconnect and give yourself a 30-minute limit on social media each day, or to start exercising, taking those 15-minute walks each evening, even if you don't feel like it. Or if your purpose tire was flat, as you create this balance plan that you see here, maybe you'll find a cause that you really care about, that you could start supporting in some way, or maybe you'll learn a new skill that you really value. So that'll be one of the things that we encourage you to do as a takeaway, to take time and inflate, again, your flattest tires, to really enable you to take those next steps if you're feeling stuck. Now, another barrier to living by our values, right, and feeling unfulfilled is the behavior of dwelling. That's when we hold on to sour thoughts about, the past or the present, and our mind just kind of mulls over those things. Maybe it's regrets, mistakes we've made, resentment. Maybe something happened to you that you didn't have control over. Even just preoccupation with things that I don't like about the world right now, whatever it might be. It might be that these thoughts are true, but still, they only serve to keep us stuck and feeling down sometimes. Take a look at this animation, one more here, from one of our programs that touches on this subject.
Remember, our mind wants to hold on to a thought, like a dog wants to hold on to a chew toy. Getting it to let go is nearly impossible. The dog, just like our mind, bites down harder. But the same tricks that work with a dog can work with our mind. If you give the dog something else to chew on, he'll often let go of the first toy. Likewise, we can give our mind something else to chew on so that we relax our grip.
And so, holding on to those thoughts, dwelling on these things that we can't really change doesn't usually work well, right? But focusing on something else requires that we give our mind something else to chew on, just like that dog. It could be something really positive, like pausing when I catch myself dwelling and identifying 4 things that I'm grateful for. And I imagine that. Or I could find maybe 2 new ways that I could help another person right now. Maybe I'm going to get up and go help them, just to change that thought track. Not only are these kinds of thoughts great because they boost our mood, but they also, again, they tie up our minds long enough that our minds shift away from whatever we were dwelling about in an unhelpful way. But it is okay to choose something more neutral, like quizzing myself, even something as simple as doing a few math equations in my head, or listing as many states as I can think of in the next 30 seconds. Why not? Or I could do something like a mental game, right? Saying the alphabet backwards. The key really here, no matter what you choose, is that I do a task that consumes all of my mental attention and energy. So I'm actively removing those dwelling thoughts and that dwelling thought path that was keeping me stuck. Now, if you recall from earlier, let's go ahead and visit these stories that we introduced at the start of our time. Margaret has 2 young kids in school. She's building out a lot of those summer schedules for the most part on her own. It's a lot on her shoulders. She's working more and more hours at work, feeling kind of at a loss with direction as her own roles are changing. As she considers her values, she realizes that she wants to be known as someone who loves and helps others, including her family and community. But that alone helped her then creatively come up with some new family activities that they could engage in, like volunteering together. So when she looks at her calendar, she now has a fun monthly meal packing events to look forward to. It's a win for everybody. Then we had Micah. He was feeling empty after long work hours, left him feeling tired, not taking time for things that used to bring him joy and life. Well, he realized that even though he was feeling drained, he wanted to reprioritize and take time to get outside more. An exploration of his values revealed that in the months to come, he wanted to be spontaneous again. And I can kind of relate to that. How about you? And so as a part of his plan for connection and addressing his health, well, specifically his emotional health, he said, I want to clear my schedule one evening each week and take some time off from work, even for a couple long weekends. What would he do at that time? Well, he wasn't quite sure, but what a great opportunity for that spontaneity, a way to feed his emotional health. And lastly, Al was a few years away from retirement, but was in need of some change, both in his personal life and at work, something to help him feel energized again. When it came to his 4 tires, it turned out that his purpose tire was a little flat. He really values his job and recognizes the stability that it brings. So to bring more purpose to his days, he decided to start a mentorship group to help guide and inspire a few of his younger colleagues. And outside of work then, he'd start by volunteering once a month for a nonprofit that he had recalled had helped him in his younger years. Al also recognizes that he's been dwelling when he recalls and feels regret about the years he wasted when he was younger on unfulfilling work. So when those thoughts come up, he uses alternatives to dwelling. He either lists 2 new things that he's grateful for, or he chooses the math problem in his head. He finds that he's now able to live more in the present, and he feels more energized by and grateful for all that he does have. And now, the most important thing today, again, is that you take action. We encourage you to pick one of the strategies we talked about today, at least one anyway, and put it into practice. Maybe you've decided that you could benefit from further defining some of your values. Those 4 statements again that you could build on, or maybe you identified a flat tire or 2. Again, those areas of health, stability, purpose, and connection. You'll have that handout that'll be helpful. And, so maybe it's time to create a balance plan to inflate one of those tires. Or maybe you want to make a habit of using alternatives to dwelling. You might be surprised actually by how many times you catch yourself dwelling if you just watch out for some of those thoughts. And again, some of those thoughts might be contributing to you feeling burnt out, but they don't have to. And the good news is there's an excellent 3-step model that you see here that can help guide you in this habit building process. So a cup of coffee that you see here represents something you're already doing. Maybe it's a cup of coffee or tea each morning, when you sit down for that warm drink. Okay, that's when you're going to do your new habit. Maybe it's simply reading over your new list of values as a reminder of the things that you really care about. Set the tone for each day. And then after you do that, these clapping hands here represent a reward that you give yourself. Maybe it's, playing your favorite energizing song. It could be a tear-off cartoon, or it could be a simple pat on the back. So whatever that looks like for you, again, we really hope that you'll take action and apply what you've learned today.
All right. Well, thank you, Jess, for sharing that. And as we close today, we certainly want to thank you for letting us share a bit about Learn to Live and the programs that we offer. And just a note, Kim will go over some other resources in an email follow-up that are available for you today, and how to access the other content on our site to deal with various challenges that you may be facing. We are including the balance plan in a follow-up email, as well as 2 articles. They're really short. They're 1 pages. one page in length, but they're easy to print or certainly, attached to an email to share out, but they are on the topic of pressures of caregiving and taking care of you. So we wanted to include those, as well as we on our site have a number of recorded webinars, and a couple that I'll just call out that I think might be of interest to you. We have building emotional resiliency, coping with grief and loss, and then managing stress and worry. So that information will be in a follow-up email for you with a link out to our site if you'd like to access that information. Right.
Well, thank you, Kari and Jess. We appreciate you sharing the insights and also for putting these resources together to share with the whole Lutheran Services in America network. We have time for a few questions, so let me pause here and see if there are questions. Feel free to chat your questions if you want to chat, or go ahead and unmute and ask Jess and Kari your questions.
I can jump in here first. There was a question shared with us that about habits, and they said, when something is really hard to start, are there tips that you would recommend to make it a habit, to overcome that fatigue of getting started? And again, the good news for the person who asked this, you are not alone. So this is a topic that is written about a lot out in the literature. And one of the best things, one of the best suggestions I can offer is to start small. And, depending on what that big long-term goal is, it might be really hard to think about what starting small actually looks like. But again, it's easy to kind of break it down, considering kind of a health goal, right? That it might be working in simply, maybe you want to eat healthier, right? Well, oh my goodness, that's a huge lifestyle change for many of us. And so it might just be eating one serving of fruits or veggies a day, just one, and starting there. And maybe after a week, you assess, see how you've been doing, and bump that up to 2. If you had a veggie before, maybe now it's eating fruit or exercise. There's some really great stuff out there that, it's like maybe the goal is not even to do an exercise or a workout, right? Maybe you've got that gym membership that you haven't been using for months. Maybe it's just stepping into the building and that's it. Maybe that's the starting point. Maybe it's even just putting on those shoes, stepping out the front door, and that's the goal. What you'll find is that, you may end up building on that. You might actually go for a little walk around the block, but that's the whole point. That starting small can be a great place to start. I hope that helps. Feel free to ask more questions on that if there's more you'd like to hear.
Great. Thank you, Jess. And there's a question in the chat, and Kari wrote an answer. The question was about how many people have Portico and Learn to Live helped with this approach. Kari, you put an answer. Is there anything else you want to add to that?
Yeah, yep. And I'll just kind of add to that too. We do survey our members, which is great. We survey them a couple of times a year. And on the most recent survey of Portico members who are engaged with Learn to Live, 98% reported they were satisfied with Learn to Live as a product. So just a great testament to the resources that are there, and that they're certainly using those resources. So great to see.
Yeah, well, we're great to have you as a partner. I hear good things from our members too, as I'm out and about.
Good.
And so I know people are getting good value out of it.
Great.
Okay, another question. As a supervisor, how can you support the employees on your team when you're also feeling drained? How do you keep the energy up?
That's a great question. I wish there was a one size fits all, don't you? Yeah, I suppose that, that is tough. That might vary depending on the person. I can imagine that having a supportive person, maybe you do have someone that can support you at work, but in positions of leadership, I don't know what the quote is, but there's a reason that whoever once, said that leadership is a lonely island. It is, unfortunately, in many cases, but that's where it's important to build those supports outside of work if you don't have them at work. I think one thing that we get in the habit of doing because of our fast-paced society, right, is just nose to the grindstone, and we just go all day, and we don't take those breaks for ourselves. Yes, there's a lot of deadlines to be met, maybe other people, right, to attend to other important issues, but if you imagine how much more effective we will be as people, trying to relate to each other and also in our time use, I think we really do benefit more than we'd like to admit from pausing, stepping away for even 5 minutes to take care of ourselves, get fresh air, whatever it may be. I know not everybody here has access to Learn to Live currently, but some of the ideas today, maybe it's choosing to say, okay, I feel myself kind of getting down right now. I'm going to use that alternatives to dwelling, right? And there's a lot of other strategies we could go into. They may also be part of those articles that'll be shared out as well.
That's great. Well, thanks for that. The resources. I gave a talk just recently, and I talked about this is an oxygen mask moment, and the put your own mask on first. And I think that as leaders, it's really important to do that. But also the thing about putting a mask on is it's very visible. And it seems to me that as we talk to those around us, our employees, about how we're taking care of ourselves, we show some humility that we recognize we all need help. And I think it makes us better leaders, but also role models to our employees that may be wondering what they do. So thank you, and thank you for the resources. Let me, there's another really good question that's just so germane to the kind of work that so many of us do. Part of our employee burnout is also related to secondary traumatic stress due to the nature of our work, caring for others. What are some ways we can support and help our employees with inflating their tires at work?
That's so good. And that's, the topic of trauma is really complex. But if we can simplify it as much as we can here. And I love what you said there, Jeff, that, when I think it goes a long way to actually say, you know what, I'm human too. And I actually suffer with this some myself. Maybe you're able to share some examples of how you are taking care of yourself in hard seasons. I think too, encouraging those people to take a step, whether it's formal, therapy or something, or if it is more of a self-guided journey, that is, as much as we can encourage them to take those steps outside of work, it will certainly help them feel like they've got those tires inflated at work. We hear more and more about companies that are building some of these important mental health, emotional health topics and services, support resources into not only their offerings, EAPs, that kind of thing, but also creating space for it within the workplace, within meetings, even if it's just a one-on-one touch point. Those can be really great opportunities for conversation starters. So as leaders, that I definitely would encourage you to do those things as a starting point.
Great. All right. Another question here is, do you see people moving from online CBT to seeking in-person therapy?
I can take that one, Jeff. And we do actually. We see that certainly a question that we do actually ask on our member survey as well. We often ask, did Learn to Live inspire you to seek in-person therapy? Knowing that for some that can be a great fit. And I can note that on the last member survey with Portico members, 20% said, yes, they were inspired after working in a Learn to Live program to seek that in-person therapy. So certainly as a a group of benefits that are available. There's a variety of things and different needs. And so certainly we know that an online program may not be, what everybody needs. So there's lots of opportunities there, certainly for someone to start maybe and learn to live, and then be encouraged to seek that in-person support if that's needed as well.
So it sounds like, it could be the encouragement, to get help and then learn, what CBT can do, but then, find out, okay, I can use some more help in another area. Great.
Yep, absolutely.
And I really, comment, I really love that idea of dwelling and noticing where we are getting stuck. And then, like the dog, okay, well, what else can I put my mind on? There was a question about, or kind of a comment, but I see Jess or Kari, if you have anything to add to it, that self-care is more important now than ever with events, not only going on at work, but outside of work. So for example, the violent shootings that are just, all, in the news and around us. Do you want to comment on how Learn to Live looks at kind of the whole life, not just the work stress?
Yeah, definitely. I mean, work is really just a small part of our lives, right? Yes, it's a really important part of our lives, but oh my goodness, those stressors come from all parts of life. And, it's, I think, in that idea that some people come to Learn to Live and they decide to move into in-person support. Part of that is because we realize, oh, these other things that have been kind of a challenge for me, maybe I don't have to stay suffering in those things either. I didn't, they maybe didn't even realize that those are things that can change and that can improve. And so I'm really glad that that's being brought up here in this group. That's so good.
And just one, maybe that's our last question about the resources. So just want to be clear what we try to do. And again, thank you for the help from Learn to Live, because they put a lot of resources together for this. In the email, you're going to get a link. You're going to get the PowerPoint. You can print that out. There's the worksheets, though, a link to the Learn to Live website with some of the videos that you already saw today that you can use, but also the worksheets that Kari and Jess walked us through. And those are free for you to use. You can show them, to your employees or share them in other ways. And hopefully that will be a good tool for you. So I think we need to move into the wrap up again. Thank you to Carrie and Jess for all of the prep and for spending time with us. Yeah, at Portico, we know that our employers and members give themselves in service to others every single day. You shared some examples of that in the chat today. And in order to do this work, we know that you need to be healthy and well cared for, or you risk burning out. And to that end, as I mentioned, you're going to get some follow-up resources that we hope that you find useful and leverage with your team as you desire. And if you've got more questions for us at Portico, please feel free to reach out to me directly. We'll put my email address in the chat, or Ross Eichelberger. Ross is the head of our business development team. And thank you for that time together. And with that, Charlotte, I think, we need to show you the important disclosures slide. And then Charlotte, I think I turn it back over to you.
Great. Thank you so much, Jeff, Jess, and Kari, for sharing all of your insights and expertise today. And thank you, Portico, for your leadership and your ongoing support. As Jeff mentioned, you should expect an email from Kim Roque, which will include the recordings and all of the resources that we discussed today, a robust set of resources. And thank you to everybody for participating today. And please stay tuned for additional Strength and Service series webinars that will be coming in the future. So thank you again, everybody. Have a great rest of the day.